We're pleased to welcome back today Dr. Jeff Rohde to our broadcast. Dr. Rohde runs a practice in Santa Barbara, California, and is also a member of our editorial advisory board. Dr. Rohde, thanks for joining us.
Thanks, Noah. It's always good to see you.
So we last spoke with you a couple months ago during the shutdown phase of this pandemic, and at that time, you were preparing to reopen your practice and you were facing the scramble for PPE and getting your staff back on place and changing how you're going to do things. So can you give us an update? What was it like getting back to work and how have things been going?
Good question. There's kind of multiple levels of stress, especially because, at the beginning of all this back in March, we didn't know how long it would last, but we knew it might be bad. And so we actually donated most of our PPE to the local hospital here, Cottage Hospital. And then turns out not only was it not that bad, which was very favorable, but we actually had a hard time getting a hold of it again because supply chains ran short of it. I know, we often work with Patterson and they're awesome at it. And they're just like, we were just having the hardest time getting it. So even as we decided, May 18th, that might be a great day to open, it was still contingent on getting all this stuff. So we were able to secure gowns and face shields and everything else, but we didn't have N95 masks. So to open, we started to take care of our people. We literally had, the 3M cup white N95 mask that we put our mask over that for moisture barrier protection, just to be able to do something. Now we're kind of back and rolling and stuff's kind of, we're getting the stuff. So that's going, but it was just another example of just another kind of stressful thing. I would say the other stressful thing is just kind of, we didn't know what our patients would want to do. We didn't know if some people would be like, hey, you know what, I know it's still a little scary out there. I will feel more comfortable staying at home. And we are going to be, of course, open to that. Well, it turns out 99 out of 100 people were like, yes, I want to keep my dental health on track. I want to come in. And if anything, the overwhelming sentiment was, well, I assume you guys will have PPE and I assume you know what you're doing. You're a dental office. Of course you should know how to sterilize instruments. And that, weirdly enough, was the overwhelming response. They're like, I wouldn't come to you guys if I didn't trust you. Now, some of that comes with, you got to make the place look like it's clean. You have old orange shag carpeting on the ground. That's going to be hard to clean that. But I just mean, it's a lot of it is then making sure your environment and your team is up to speed. And that was, I would say, the third challenge of reopening is, our team, we had a few that were just nervous. It's like, well, but what is it going to be like? And are we going to get it the moment we walk in the door? And maybe we should be doing testing every other patient. And a lot of it was making sure that we had individual one-on-one conversations and a few different Zoom calls with our team where we basically said, here's the recommendations, here's what we're doing. Anything else? What is it going to take? I want you to feel so comfortable being here that you feel comfortable to tell a patient it's okay to come here, was the concept, right? And so we just had several meetings on that and made sure that we had all that in place. Well, 3 days in, we were changing everything again. We started on this limited schedule and we only had 2 or 3 people here at a time. And all of a sudden we're like, we had this whole plan on how we're going to slowly reopen. And then the schedule was like, a horse running out of the barn. It's just like, all of a sudden it was just taking off. We had to change a little bit of our flow. We're texting people from their car now. There's all these little things that we're doing, but I guess overall, I'm thankful that we're all involved in a profession that never went away. In fact, it created even more need for us to be present, be open, take care of our people.
Yeah. So in terms of, changes in reopening, were there any things that you've been doing differently that have presented challenges for the practice? I imagine with some of the things you're trying to do, keeping this flow of patients would be, pretty hectic with trying to maintain the sanitization and sterilization requirements as well.
Yeah, I mean, we have padded time to
Mhm.
each one. If anything, on the assistant side, we are a little not overstaffed, but a little plus from where we were scheduling before, just to give everyone time to help each other to turn a room around and give it time to just like, you know, um, do things properly so no one's rushing. We're doing things like staggering hygiene appointments, so that you don't, you know, we have 4 hygienists a day, 5 days a week. So all of a sudden at 8 o'clock, you'd have 4 people coming up the stairs, you know. And so differently, what we've done is we've staggered their start times, and we, using our appointment reminder system, we happen to use Yappy, which is a great system. But from their appointment confirmation text, they'll text us when they're here, and right at the desktop computer at the front, we'll tell them, okay, now it's your turn to come up. So they'll stay in their car until it's their turn. And then we have one person come in, we ask them the screening questions, we take their temperature, and then the hygienist is sitting right there ready to take them away. So we don't even use our reception area other than having a place for people to walk into. There's no people just sitting there anymore. So that was a challenge. And that's why 3 days in, we're like, oh, well, we got to go here and you got to make sure you're ready over here. I mean, this is a time in which I think it's more crucial than ever to be very dynamic as a business, so that you can kind of adapt very quickly, because who knows what's going to happen next week. You know, it's changing so fast.
Mhm. In terms of changes to, you know, procedures, I went in for my 6-month prophy last week, and they were no longer using their ultrasonics. It was all hand scaling for the hygienist. And I'm wondering, have you made similar changes like that, or are you guys doing what you've always done in terms of technology and treatment procedures?
Yeah. Well, one thing before is that we were already using N95 level masks, right, for aerosols being generated. It almost seems like one of the top aerosol generators is probably ultrasonics, right? I mean, you just hold
Yes.
it up in the air and you see the stuff spraying off of it, you know. Um, so for ultrasonic procedures, there's face shields that they use, N95 masks. We had to, you know, we 3D printed these clips so that they could clip their face shield to their actual loop, so they can still use their loops and their loop light.
Mhm.
And then the shield clips onto that. Um, but also, we had 3 of our rooms that weren't really using high velocity suction.
Mhm.
So we retrofitted those rooms. So we're actually backed up on Newbird. Basically, think a mirror with holes in it for suction that hooks up to your high vac.
Yep.
Um, so currently, if there's going to be any, you know, ultrasonic scaling, they'll still do it with proper PPE, but you have to have a high vac on it.
Which from the studies I've seen, that HVE can remove 90 to 98% of the aerosol particles anyway. So it
Right, and
seems
it's
like,
sitting right in front of it, and
yeah, it does seem like this is the safe way to go. In terms of other strategies, I've learned a heck of a lot about how particles move through the air once being aerosolized in a dental practice over the last couple months. I've learned a lot about different sterilization technologies, and I've seen lots of people bringing extraoral evacuation systems and UVC lights and all sorts of other air filtration approaches. Have you looked into any of those for your practice? Are you implementing anything like that?
I mean, we got some air filters that were basically designed to service about 800 or 900 square feet,
Mhm.
um, and we basically bought 15 of them. Our practice is not 15 times 800 square feet. We just dropped them in every single room,
Mhm.
so that we'd have an overabundance of filtration. We have them in hallways in the reception area from where people walk in. We also renovated house air to have HEPA and UVC filtration in the actual HVAC unit.
Yep.
So that's kind of how we handle there. We haven't really invested in the whole room, like whole room UVC,
Mhm.
um, because and if better studies come out to show that that's worth it, we certainly will. I think for the most part we're trying to do everything we can, but um, you know, the thought of doing things like, oh, retrofitting your entire practice for, negative pressure, it's just a cost exorbitant thing. I mean, there's no way we can do everything. And that kind of comes with sort of a caveat to it. If this were the right way to do it, we would do it. It's cost of doing business. What we're also trying to weigh is, well, is there any evidence that what we're doing is not working? So if I'm using an isolite and I have an assistant with suction right next door that's already potentially taken 90 to 98% of the aerosols out, do I also need an extra oral trumpet right next to that patient too, right? Those, I mean, the question is, A, is it working? Is it helping the patient? I mean, really, weirdly enough, the discussion of this has kind of come down to, it's not just about the patient feeling safe, your team has to feel safe, right?
Yeah.
So it's personal protective equipment. It's not patient protective equipment.
Yeah.
And it's not that our patients are important. That is exactly what we're paranoid about, but we're just looking at all these things to evaluate it, and we haven't found any good reason why an extra oral suction C in there is going to be better than having the suction from the not to mention, the noise pollution that comes with that. I mean, those units aren't quiet. So, we have basically room by room filtration for that. And that's kind of where we've landed. And that's where we're constantly paying attention to whatever information we can, so that if someone comes in and goes, yeah, hey, this $20,000 whole room UVC machine is the only thing that's going to protect you guys, then and we'll do that. We just want to make sure we're making good, educated decisions based on current evidence.
Have you been explaining these new things to your patients as they come in, pointing out this is one of our new air filters and that, or are they just kind of picking it up and understanding that you guys are taking care of the space and the people in it?
Yeah, half and half. Well, most people really are on that side of, oh, okay, oh, that's great. The thing's down there. Okay. And it's not that they don't care. It's just that they trust us to be doing the right thing and doing everything we can. So well, of course, I wasn't really worried about it before, but hey, thanks for explaining that. We have staff walking around in the office. Everyone's wearing a mask. Even so, in other words, we're still, even our staff, social distancing from each other. Things like that. We do have some patients that come in and are just very nervous. We had come in the other day and just decide she just wasn't up for it, and that's okay. And I think our response as clinicians should be to kind of reach out in compassion and just basically, hey, tell me why you're nervous, and not as a judgment thing. It's not whether you believe masks are important or not out in public. It's the fact that we're treating people's emotions too, and I think it's important to make sure that you're touching base with your patients, and if there's something that you're not doing well that they have a feedback for, then listen to that and go, well, what makes you uncomfortable? How can we be better? Because a lot of people just don't know. We had someone ask one of our hygienists the other day on a routine, not even polishing, and she's wearing N95 eye protection, hair cap, and there's no visible skin. And she asked, why aren't you wearing a face shield? But it wasn't she wasn't asking, why aren't you protecting yourself? She perceived that the face shield somehow protects her as a patient. So a lot of what we're doing is just kind of educating them to say, no, here's what we're doing. Here's why we're doing it. Here's our philosophy. Here's what we're doing to keep you safe. Listen to what they have, but kind of sometimes gently pushing back and saying, well, here's what this is actually for, and here's how we're reducing your risk in a way that doesn't demean them for not knowing or whatever,
Yeah, and I've seen a lot of media coverage of these studies showing that, dental hygienist is the job most at risk for infectious diseases, and a bunch of other dental positions are there as well. I've seen this trumpeted around, and so I think that's giving patients this impression that it's a place where you're going to get sick. But as you mentioned, it's the staff who have the bigger risk. they're in there all day seeing different people. So how has your staff been adjusting? I know that, they had concerns before reopening. You mentioned that earlier. What's that been like, and how have they reacted over the last month with some of these new PPE requirements and things like that?
Yeah, so I think a huge part of I think a huge part of it for us was just having them get back to work. Um, there's a part of this that when you're at home and you're just watching the news and you're on social media, the world can seem like a very scary place. And part of this was we just said, look, just come on back. And when they did that, there's kind of this realization of like, oh, okay, this is what we do. And seeing the environment they've been protecting for years and getting to a point where they're kind of like, oh, okay, this is actually safe. I can do this. I don't need to come here in fear. I don't need to change professions. Just because they're kind of, it's almost like, my gosh, with the world, so many things are happening right now and so much is out of our control, and we're asking and grasping for control back on some really button pushing issues, that all of a sudden to have them come back and go like, oh, here's a space I can control. I can't control the beach. I can't control Trader Joe's, but I can control this environment and keep me, my colleagues, and my patients safe. And just bringing them back into that mix was huge. It really kind of pushed back some of those fears on that. Now, even after that, it's every day how's it going? Is this working? What do you think of that? Hey, and we have little violations all the time. Someone will just forget, and with gloves on, adjust their mask. And we all know you're not supposed to do that. So then when the patient's gone, making sure we have a little, hey, and our staff does it for me, you scratch the side of your head, while you're whatever it is. I mean, I think there's a part with the staff as they come back. It's not a judgmental, but almost kind of an encouraging teamwork, kind of making sure we're all looking out for each other, because no one's going to be perfect. It's like the first few weeks, our staff was so nervous. We got to do everything perfectly. And it's like, no, just be yourself, and let's just watch out for each other.
In terms of the practice, your practice, and the technology you employ, I know you use CAD CAM, you use a laser, and I've seen a lot of those companies promoting these are solutions to help you practice faster, safer dentistry going forward. You've used these technologies for many years at this point. Do you think that this is something other practices could use to make their care more efficient and therefore possibly safer for everyone involved?
Well, let's just think overall about let's take one technology like chairside CAD CAM. I mean, the thought that these things are non-aesthetic, that if you still think that, you're not paying attention. If you still think they don't fit well, you're not paying attention, right? So these are quality restorations. There's a lot of good companies doing this now. There's a lot of amazing materials like these zirconium materials. So this is a good one. So every time you come in contact with someone, you're increasing your risk, right? So now if you're, for example, making a provisional crown and you got to have them come back, when you screen them at that prep appointment, or, oh, I chipped my tooth. Okay, now we have to schedule you for your prep. Now we have to schedule you for your drop the permanent crown in at some point weeks later. Oh, your temp fell off 3 times. Those are that many more touch points of potentially interacting with that person who could have it. Because let's be honest, especially as our government has decided to not do any more testing, and that if we just stop testing, the cases are all going to go away. That's such terrible junk science. Cases will continue whether we test it or not, and we need to track and kind of, I guess, operate as if everyone comes in the door potentially has it. That's what universal precautions means, right? Because this is going to be our life for months and months and months until there's a vaccine, right? So why not minimize the amount of time you're actually interacting with that patient? Like, why see them 6 times, and in between they've gone to this birthday party and this wine tasting event, and then downtown and to the beach, and then, you know, and let's get them right. We know they're healthy today. Screen them, put in the final restoration. They go home with a good quality restoration, less sensitivity, no maintenance from a provisional falling off, all these things, right? So just alone on CAD CAM, that's one thing, right? Now add things like 3D printing. You know, a lot of labs shut down completely. And what do we see more than anything? We see people grinding their teeth like crazy. They're stressed out, they're angry, they're frustrated, you know, and we see people break and grind their teeth, all kinds of TMJ issues. So we have the ability, you know, with our Sprint Ray 3D printer to just print a night guard right there. Completely changes the perspective, right, on how we can get people to therapy, you know, good therapy faster. As you know, I have Saleha from Convergent Dental, right? I mean, the laser vaporizes everything it touches as it goes along. So the thought of any, you know, if the patient even has it, this is vaporizing everything it touches in the first place. So, and they have some good studies that they've done on this too. So now the potential for aerosolizing virus has been reduced 99% with some of the studies they've done. Now I'm not throwing this stuff up into the air if I could do laser dentistry, right? So that's just, I mean, just off the top of my head, I mean, that's just kind of 3 things that we're doing to basically get people the best care they can, but keep us the safest, but minimize risk, but to roll it all the way through. You know, I'm a firm believer that the direction this is all going, in some ways, has really nicely kind of merged where dentistry was going anyway, to do things like laser dentistry.
Yeah. You mentioned a little bit earlier about, you know, there's the talk of slowing down or stopping testing and things like that, but cases in California have been rising, not as fast as some states, but faster than people would like. Are you concerned about the possibility of another shutdown, and would that be a big challenge for your practice?
Well, 100% what we're going to comply with is what our state and county and town tell us to do. Is we're going to do it. Now, what do I believe? There's other countries that certainly did social distancing, did rapid testing, like Germany. You know, they didn't necessarily shut all of dentistry down, and you know, there's no traces of cases that were developed from a dental setting. This is kind of what we do. We do infection control. I mean, forget COVID. It's TB and HIV and, you know, hepatitis B, and I mean, there's a whole bunch of the flu. You know, we didn't shut down in November when flu season came around. So while I say we'll comply, personally, I think we should not let people's health deteriorate. You know, I mean, delaying treatment, letting periodontal disease go unchecked. I mean, we've already seen where patients we diagnosed in February with something, then they were supposed to come in March, and then we had to reschedule them because it wasn't, you know, like mission critical emergency. And now they're coming in and we're finally seeing them again, and there's extractions, root canals, gum disease that we're seeing because we delayed care, you know. And I'm just not sure that's the right way to go. I don't want to treat an active COVID-19 patient, right? I think we can be smart about that, but I think if we're doing good screening and doing the best we can, protecting ourselves, and then again, assuming they have it anyway, I'm not sure why we necessarily need to shut down for that.
I think that lines up with a lot of the research I've seen, and yeah, the fact that I have yet to see any reporting of a confirmed transmission from a dental setting anywhere around the world. So if you know, that's the case, as you said, you guys are already doing this work. You've been doing it for years because of all of those other conditions. So I think really happy to hear that it's been a good recovery for your practice and that you guys have been able to safely see so many patients and handle so many people in need of care lately. Really good to hear.
Yeah, and admittedly, it's great. Every time we have a new patient come in, I mean, not a lot of good news out there, it seems like these days. And, every time we have someone come in and they're doing well, their family's doing well, their teeth have held up, they didn't deteriorate over time. It's all great, really great positive news. And I think I'm often thankful that we get to do something that's really helpful to people, but B, we're in an industry that will weather this storm. I mean, we rapidly came back to work. It wasn't like, well, okay, I'll see how it goes. I mean, there's certain industries that are going to be irreversibly long-term affected by this. And, no matter what happens, people still have teeth problems and we're here to help. Um, you know, and that's not anything that's going to change in the future. So I am very thankful to be in a place where we can not only help people, but have a little job security in a way, knowing that we'll be here for everyone.
Well, everyone does have a mouth, so something that you could help take care of with just about anyone.
Yeah.
Dr. Rohde, we really do appreciate you taking the time to share your experiences with all of us. Stay safe, and we'll talk soon.
Thanks, Noah. Great to see you again.
Good to see you as well.